Medical Dialogues. I am Anshika Mishra. Here's what I bring to you from the world of medicine. Energy drinks linked to poor sleep quality and insomnia among college students. Consuming more energy drinks is linked to poor quality sleep and insomnia among college students, a large Norwegian study finds. The study is published in the open access journal BMJ Open. Energy drinks contain an average caffeine content of 150 mg per liter, as well as sugar, vitamins, mineral, and amino acids in varying quantities, note the researchers. While there is some evidence to suggest that they reduce sleep quality, it's not clear exactly which aspects of sleep might be more or less affected, or whether there are any sex-specific differences in these effects. The researchers drew on 53,266 18 to 35-year-old participants from the Students' Health and Well-being Study. The students were asked how often they drank energy drinks, with the response option of daily, weekly, that is once, 2 to 3 times, 4 to 6 times, and monthly, that is 1 to 3 times, and seldom or never. They were also asked detailed questions about their usual sleep patterns. Sleep efficacy was then calculated from total nightly hours of sleep versus time spent in bed. Insomnia was defined as the experiencing difficulties falling and staying asleep and waking early on at least 3 nights of the week, plus daytime sleepiness and tiredness for at least 3 days of the week for at least 3 months.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Men with inflammatory joint disease less likely to be childless than healthy peers. Men with inflammatory joint disease such as rheumatoid arthritis are less likely to be childless and have more children than their healthy peers, according to the research published online in the medical journal Annals of the Rheumatic Disease. Autoimmune diseases are on the rise, and impaired fertility has been reported in Norwegian women with inflammatory joint diseases. But only a few studies looking at the potential impact on males' fertility have been carried out. To explore these issues further using childlessness and number of children as proxies for fertility, the researchers drew on a national group of 10,865 Norwegian men with either rheumatoid arthritis, that is 37%, psoriatic arthritis, that is 33%, or spondyloarthritis, that is 30%. Each of them was matched with 5 healthy men, that is 54,325 from the general population. Between 1967 and August 2021, 1,11,246 children were born to the total number of 65,190 men. Average age of first-time fatherhood was 27 among the men with inflammatory joint disease and 28 in the comparison group. The average age at the diagnosis was 44. Births and childlessness were divided into 3 time periods, reflecting major changes in drug treatment for inflammatory joint disease. That is 1965 to 85 before the advent of methotrexate, that is 575, 1986 to 99, methotrexate, that is 31,360, and 2001 to 21 with the use of biologics, that is 8,930. Does bizarre visual symptoms indicate signs of Alzheimer's? A team of international researchers led by the UC San Francisco has completed the first large-scale study of posterior cortical atrophy, a baffling constellation of visuospatial symptoms that present as the first symptoms of Alzheimer's disease. These symptoms occur in up to 10% of cases of Alzheimer's disease. The study includes data from more than 1,000 patients at 36 sites in 16 countries. It publishes in the Lancet Neurology on January 22, 2024. Posterior cortical atrophy overwhelmingly predicts Alzheimer's, the researchers found. Some 94% of the PCA patients had Alzheimer's pathology, and the remaining 6% had conditions like Lewy body disease and frontotemporal lobular degeneration. In contrast, other studies show that 70% of patients with memory loss have Alzheimer's pathology. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.